the fact that our program has a fairly strong presence in brachytherapy, I knew it was something that practices I would be interested in, as well as disease sites I was interested in treating. I knew they would value this additional training that Fox Chase offers.
Right away from my day of interview, I just knew that from meeting with each of the attendings and meeting all the co-residents, I knew that it's a family environment, and that's what I was looking for. I wanted a world-renowned institution that's going to train me well, but also where I'm going to feel very comfortable. I feel like I fit in and I'm part of the team, and that I'll be working in a place where I'll wake up every day and look forward to going to work.
I was drawn to Fox Chase because I just felt like it just had a really family feel, and it everyone seemed to really get along and seemed to work together well, and that's the kind of environment that I wanted to be in.
So there were several things that impressed me. First, how much the doctors seemed to care about their patients. They seem to know a lot about their patients, their lives, their families, their jobs, and so on. I really liked the idea that they had real relationships with their patients. The other thing was how well the doctors got along with each other. Everyone was very approachable. I remember I went to a conference and obviously everyone was very, very knowledgeable, but there wasn't a sense that people were really competing with each other. There was a sense that people were working as a team.
I have currently signed a contract to work in the city of St. George in the very southwest corner of the state of Utah. It's about an hour and a half outside of Las Vegas. There's 5 radiation oncologists in the region there, 2 different groups. And, I felt that there were actually 2 job offers in the state of Utah, and they were both in the city. And I interviewed for both opportunities, and ultimately was super excited with the chance to work for this group.
I'm currently located in Texas, in San Antonio, Texas, at Brooke Army Medical Center. I'm active duty in military.
I'm currently working at UT Southwestern in Dallas, Texas, in an academic position treating head and neck cancer as well as skin cancer.
I relocated back to my hometown near Scranton, Pennsylvania. So I work in private practice. Our group is Northeast Radiation Oncology Center, and we're located in Dunmore, so about 10 minutes outside of Scranton, my hometown. And I'm also part-time adjunct faculty at my alma mater medical school. So I'm a clinical assistant professor of medicine at Geisinger Commonwealth School of Medicine as well.
So I think the Fox Chase residency prepared me extremely well. Everyone just has a very open door policy, so it's very conducive to learning, because I didn't feel uncomfortable going to any of the attendings. Doesn't matter what rotation you're on, whether it's GU, breast, gyne, lung, all the attendings have a very open door policy.
The residency at Fox Chase really prepared for my current career by instilling me a lot of confidence and responsibility during my training. I think there is a lot of one-on-one relationships that we build as we go through the Fox Chase residency.
Training at Fox Chase Cancer Center allows you as the learner to take whatever role you want to play. It requires self-directed learning, but with that, you get to choose how you do that. And I felt that was really advantageous for me, because I could carve in my study time around a family life.
Coming from Fox Chase is a privilege, because the moment I got to Brooke Army Medical Center, people want to know, hey, how did Fox Chase treat this disease site? How did Fox Chase do it? And it's a neat feeling to know that you might be new, but since you train at a very well-known institution, that people want to know your thoughts and how you would approach an oncological problem right away as a brand new attendee.
One of the things that really stood out to me during my residency training years, and something that actually drew me to the residency program, is just the camaraderie that everyone has in the department. I think everyone is truly working together to, care for the patient. And what you will notice is the patients notice this as well. You will hear this constantly, that there's no other place like Fox Chase in terms of the kind of one unit feeling that you get, whether you are training here, whether I'm sure if you're practicing there or if you're a patient there.
The most significant part of my training at Fox Chase, I would say, is that there's a strong feeling at Fox Chase that everyone wants to succeed. People are ambitious, but they want you to be successful too. There are lots of faculty I go to for advice for a number of different reasons. If you want to incorporate basic research into your career, there are faculty to help you. In my own research, I've collaborated with surgeons, statisticians, medical oncologists, physicists, basic scientists, and it's been very rewarding. I also have an interest in healthcare disparities, and I'm currently monitoring an international virtual conference for Spanish-speaking radiation oncologists and medical physicists with some of my colleagues as well. And Fox Chase has been very supportive and encouraging.
And really the emphasis on resident education. So it's clear that the priority is resident education and not simply to use you for work. Any pursuit that you have that's reasonable, the program would go above and beyond to help accommodate that and facilitate that. So I think, our morning lectures, the one-on-one relationship with attendings, and the way the services are structured, really everything is paramount and focused on resident education. So I feel like all of the time spent in clinic and at the center was really valuable educational time.
I was targeting the southwest corner of the state of Utah in a small retirement town where my family lives. And all along the way, they put me in touch with different attendings, different institutions at conferences, and really helped me target this geographic region. And ultimately, about 3 or 4 months ago, signed a job to return to that community, and I couldn't be more excited.
The Fox Chase Radiation Oncology Department helped me with my job search a lot. I think it starts from early on, just helping with, trying to find things that you're interested in and giving you the opportunity to kind of pursue whatever that you want. Not everyone is interested in research, but like if you are like me, there's plenty of opportunities to do research within the department. We have many research-driven attendings who are more than happy to work with residents and or medical students. And there's opportunities to pursue research outside the department. And I did both. So that was very helpful.
The faculty and program directors were all above and beyond in terms of being able to facilitate connections. So when I went to conferences, I was able to meet new faculty that were facilitated by current faculty at our program. And, very often I would get texts and emails from Dr. Weiss about different job opportunities. So even though I was set on going back to my hometown, I also felt that I had a good, thorough support network at Fox Chase should something change.
Yeah, I think one thing I want to tell future residents is that trust your gut feeling. I think that's very important. You'll know very quickly when you walk into an institution, or in 2020 with COVID, if you do a Zoom meeting, you know pretty quickly the culture of the institution. So trust your gut feeling. The culture is very important, and you're gonna do just fine.
I think what I would want an applicant to know about Fox Chase is how awesome the program is in terms of really kind of supporting you in any way that you need to learn. Like, for example, I wanted to do a dosimetry rotation because I thought that would really help me. And I just asked, and they made it happen for me. And that's really cool that they kind of just support you in anything that you want to do.
But trying to get a sense of the culture and how the residents interact with the attendings and the other staff. And I think that, I look back very favorably on my time spent at Fox Chase and the culture. And when I think back to the interview day, I think they did a really good job instilling that culture. And I found that my 4 years in the program were very much reflective of that good feeling I had on my interview day. Again, with the virtual interviews, it might be a little bit hard to do, but I'm hopeful that this video, as well as being able to hear from some current and former alum, would be able to instill that sense of culture that continues to perpetuate.